All right, so for my project, I decided to do alopecia areata, which is an autoimmune disorder that results in hair loss in the face, the scalp, on the body. But we'll get into that in a little bit. But first, I want to clarify what makes an autoimmune disorder. So, to be an autoimmune disorder means that your immune system attacks your own cells mistakenly. So they mistake healthy cells and tissues for infections or invaders, so they attack them. So when someone with an autoimmune disorder gets sick, it is especially dangerous because the healthy cells get caught up in that immune response, meaning that they don't differentiate between the healthy cells and the infected cells. So the healthy cells end up getting killed off as well. And like I said, the healthy cells are killed off. So back to alopecia areata. The symptoms are basically just hair loss, but it can occur in many different ways, as you can see in the 4 pictures. So you may lose lots of hair in a very short period of time, like extreme shedding, or you could have hair loss located on one side of the scalp instead of the other. But the most common symptom are the hairless patches on the scalp, face, and body. And so for face, you can see right here that there is a big patch in the middle of the beard. But there's one other symptom that isn't really talked about, and it's called pitting of the nails. So in the fingernails, there could be rows of tiny little dents, and it's called pitting. But as far as risk goes, there's no specific race, gender, or age that's affected more or less than alopecia, so you can get it regardless of anything. But for statistics, 1 in every 500 to 1,000 people are affected, with 2.1% of patients having lifelong symptoms, meaning that it cannot be treated and the possibility of hair regrowth isn't really on the table. But to put into perspective on what 1 out of 500 people looks like, I did this little graph, and then that one red square is the 1% affected, and that's like the maximum, I guess, because it goes from 1 in 1,000 as well. But so as far as diagnosis goes, you can really you may be able to self-diagnose because of the visual symptoms. However, there is a difference between androgenic alopecia and alopecia areata. So androgenic alopecia is just normal hair loss. You may find this more in older people where male pattern baldness, and older women their hair may start to thin out a lot. So this like normal hair loss is not alopecia areata. Alopecia areata is an autoimmune disorder. So when patches become present and you're noticeably losing hair in other parts of the body and your nails are pitting, then you should see a doctor just to be sure. So for treatment wise, let's talk treatment. So fortunately, alopecia areata does not give the skin any sort of rash or severe itching. So it is not a painful or physically painful disorder. And before I go on, you can see these pictures where the difference between month 1 and month 6, the hair is able to regrow. So as far as before medicine and before treatment, managing the disorder could be easier than others because, again, it doesn't cause any pain. However, without hair, your body is more affected by the cold or the sun, so you'd have to be more diligent in protecting your skin, meaning that you would have to put on more sunscreen, and maybe sunscreen on your scalp as you might normally not, or, wear more hats a lot in the winter. But there are also many topical and oral medicines that can be taken in order to increase hair growth. So here is an image of all the sorts of treatments that can be used. So it first goes from age. So if you're under 10, then it recommends this medicine. I'm not going to even try to say it. But then it goes to if you're over age 10, and then it goes from the extent of the disease. So if it's less than 50 scalp, if less than 50% of the scalp is infected or affected, then these medicines are recommended, and then vice versa. If they're greater than 50%, then all of these. But it's also great to mention that not every medicine or treatment will work for everyone. So you may be wondering, why and how does this even happen? And to be honest, scientists aren't super sure. So scientists and researchers aren't aware of what exactly causes abnormal hair loss. However, they do know that the immune system mistakenly attacks the hair follicles. So this then leads to the follicles becoming smaller and smaller and eventually stops producing hair. So this image right here kind of shows this, where as the immune system attacks the hair follicle, it ends up disconnecting from these nerves and the hair bulb gets smaller. So as the bulb gets smaller, it's unable to grow, and then it doesn't reach past this stage, so it doesn't break through the epidermis. And here are my citations. So thanks for watching. Point blank, period.